All right. The Honorable Minister Tine Furbert has been a registered occupational therapist since 1999 and has served persons in the community in that capacity with experience in skilled nursing facilities, private and public school systems, a prison setting, general, psychiatric, and senior-specific hospitals. She has wide and diverse experience working with populations of special needs, pediatrics, adolescents, and adult mental health, neurology, and senior and adult health. Her strong and resilient advocacy on behalf of healthcare and disability needs is well known. She is a member of the Bermuda Occupational Therapy Association, American Occupational Therapy Association, and National Association of Healthcare Advocacy Consultants. She maintains her National Board of Occupational Therapy Certification and Healthcare Advocacy Certification. She has served as a Junior Minister for Disability Affairs. Tine is a former chairperson for the Council for Allied Health Professions and former chairperson for the Disability Advisory Council. She is a member of the Parliament Prayer Breakfast Committee and a former broadcast commissioner. She is the co-founder of Bermuda's Working Women Institute, established in 2013. Tine Furbert is an elected member of Parliament who represents St. George's South and has been appointed Minister of Social Development and Seniors. She has also served as a senator from November 2016 to July 2017. So thank you so much for joining us today, and we look forward to hearing your presentation.
Thank you, Jessica. I appreciate that introduction, and good afternoon to everyone. I think I'm the last speaker of the day. So from what I've heard thus far, it's been very interesting, particularly with the topic of self-advocacy. Again, today, I think everyone has mentioned already, I would like to thank WinReach for this Common Ground conference today and giving us a platform to speak about self-advocacy and to also acknowledge the UN International Day of Persons with Disabilities. I started off early, I was on the radio this morning speaking about UN Day for International Persons with Disabilities, and I was part of the motorcade this morning as well, which was so much fun, such a blast, and such a great way to get community involvement as it relates to public awareness for persons with disability. So we're going to get started. I'm going to share my screen. I just want to know if my screen can be seen. Not.
Yes, it can, but you might want to just maximize.
Maximize it? Okay. Is that better?
We can still see your document recovery and your other slides on the left-hand side.
Okay, how's that?
Wonderful.
Okay, great. So let's talk about seniors and what a senior actually is. A person, it's a person who is specified as, sorry, I think I have the wrong slide up. Give me a second. Sorry, let me just stop sharing a second. Apologies. Okay, here we go. If you could just let me know how, is it up again?
Yep, it's great. We just need you to make it the whole screen.
The whole screen, okay. Okay, yes?
Yes.
Okay, great. So who are our seniors? According to Google, if you did a search, or refer to a senior citizen as someone who is older, more experienced, an elderly person, especially one who's retired and living on a pension. And we would commonly know someone as being 65 years old, because that was when someone would receive their pension. But it's basically someone who is older, more experienced. And actually, while you can receive your pension at 65, persons do retire a little bit earlier, and they retire, I would say some people retire in their 50s. Or some people work later and don't retire till their late 60s, late 70s. And so basically it is older, more experienced persons. I just want to speak to seniors in general, because sometimes when we are describing seniors, or you think of a senior, you think of someone who is old, someone who is fragile, someone who may be weaker. And that's not necessarily the case, because what we have to recognize is that you can have a senior that is perfectly healthy and functioning and can maximize their work ability. And actually, if you ask anyone who's retired, they will tell you that they're probably working a lot harder than they would be if they were actually out in the working world again. And so I want us to get that narrative out of our head in regards to, when we think of seniors, we thinking of people who are weak, fragile, have no voice. I just want to share a story in regards to someone that I had visited one time in the past, and I had gone to their house to help them out with something. And I was asking the senior a question, and I realized that they were struggling with their speech. But I waited, and I was waiting for the response to my answer to my question. And I was looking at the caregiver, saying, well, can you speak? Can you speak for her so we can hasten this and quicken this up? And she didn't. She waited, because the senior actually wanted to be able to speak up and speak for themselves. And so I had to give that senior the time to actually do that. And I think that's very important, because sometimes we will, in our haste and our rush, disregard that someone who's taking a longer time to articulate something or speak, that someone will speak for them. And so we have to be able to give them the opportunity and the time to self-advocate and to speak up for themselves. So I just wanted to just start off with that, that it's important that we recognize that we don't have to speak up for people all the time. We can just give them the time to be able to speak up for themselves. As far as our seniors are concerned, it's a very important topic when it comes to seniors and self-advocacy. As a bit of background information, 10-year projections indicate that 65-year-old persons and older will increase from 16.9% to 24.9%. Currently, we have approximately 12,000 seniors in 2021. And in 2026, there are expected to be 40 seniors for every 100 persons of working age. So that's a huge statistics that we have to pay attention to. And so seniors will have a major role when it comes to advocating for their needs as we progress into the future. Why advocacy for seniors? Well, advocacy with seniors raises consciousness and helps us to organize seniors and their local communities. And the goals of advocacy should be to promote change in attitudes, policies, services, and actions, and also just being able to speak up for things in which you want and need. I don't know if anyone have heard, if you've heard about litigation guardians. Currently, we speak to litigation guardians being representative for children in court settings. And so we do know that there could be an aspect of a need in regards to litigation guardians or public guardian helping our senior population out as well. However, what I want to get out there is that in some cases, you may not need a particular guardian or a public guardian to be the voice of someone, because the first voice should be that of the actual person. The first voice should be that of the actual senior. And so when we're talking about advocacy for seniors, we have to know what our rights are in any establishment. So you go to the hospital, you want to pay attention to those signs that you see up on the wall, or maybe papers that you get in your room, and it talks about Bill of Rights. You want to know what policies and procedures are in different establishments, such as hospitals, doctors' offices, nursing homes, day programs, banks. What services are available? What rights do you have in these establishments? And I think that is most important, so that if you are ever feeling that disadvantage, that you have a clear idea what your rights are, or even any legislation that is out there that also helps with the protection of a senior's rights. And know where you can advocate, know which persons in the particular establishment you can reach out to get more answers to any questions that you may have, or any change that you would like to see. I want to mention there's also a charter of rights for our seniors, particularly for those who are needing long-term care and assistance. And again, we should really get to know what our rights are, particularly in our community, so you know what you have rights to. So let's talk about needs of seniors. And this diagram and the next one will just give us a visual in regards to what needs seniors have when it comes to self-advocacy, what sort of policies, practices we could see, and what effect or impact of that policy or practice that we could see, as well as the results if we have a certain policy and practice in place. So for instance, seniors want to participate, so that's the need. And the policy or practice is, well, seniors want to participate, but in your committee or your board, you just have younger people. And then seniors have no voice and they often feel left out if they're not being represented. Or another need may be seniors want dignity and they want to contribute. But we will have policies and practices where we are making seniors feel as though they are less by having a welfare approach to support older persons by giving handouts or giving out products without the involvement or even asking what their participation should be, or how we acknowledge dignity, versus going to a particular place, actually something being brought to them. And I'll just give an example, Meals on Wheels, which is actually brought to the home of a particular senior, which gives somebody, a dignity, dignity, because they're not out there looking as though their needs are exposed to our community and to other persons. So the effect and impact of these sorts of welfare approaches is displaced existing support systems or does not develop long-term support strategies, and family support systems break down. Another need is seniors want to continue to work. And so what often happens is private companies and government will have age limits for participation in income generating programs. And so they'll say that you have to retire at 55 or you have to retire at 65. That's the company's policy. And or even if a senior wanted to go in and be an entrepreneur, they go to the bank to try to get money to start up their business. The banking, once you hit a certain age, will not lend you or give you collateral to start a business. And so there are some programs that limit the need of seniors wanting to continue to work. And as a result of this, seniors are excluded from income generating activities and have limited opportunities for much needed income, because we know as we age, if we just get our pension, that is a fixed income, and that is something that we will have to rely on until the rest of our days, even though we know that the rate of inflation rises, prices rise. And so that is a need that seniors may want to continue to advocate for. And this is a big one, seniors needing access to healthcare. And this includes a policy practice would be primary healthcare programs do not include services or information, particularly for seniors. I remember working for a facility that just catered to seniors, and it was absolutely amazing because they were actually able to tune in on how to work with seniors, how to speak with seniors, how to make them feel as though nothing else mattered. And so we should practice, these sorts of practices in our community. Again, if seniors, the primary effects or impacts, if we don't have programs that cater to seniors, is that again, seniors will be excluded, seniors will have health complications, and will be less able to care for themselves and contribute. A senior's need, another need would be impoverished seniors who need help to meet their basic needs. Oftentimes we hear, particularly seniors who do have fixed incomes, that they can't afford groceries, as well as if they're also on lots of medication, having to make choices between their Balco bill and food and medications. And so we need to make sure that there are systems in place, support systems in place, in which people have access so that they're not, struggling to meet their basic needs. So many policies for seniors benefit sometimes only an elite demographic, particularly if we could talk about healthcare insurance. There are certain insurance plans or benefits, which we would term major medical, which will totally remove a senior from access from this top level major medical insurance opportunities and plans, because they cannot afford it being on a fixed income, and they have to allocate their monies in other ways. And so again, that impacts, because they're unable to access a healthcare industry because their insurance plan does not cover certain benefits, then we could see health complications and also seniors having to care for them, being less able to care for themselves and contribute. And out of all of those, these are some of the results that we could see. Seniors can feel marginalized. And when we talk about feeling marginalized, feeling as though no one's addressing their need, or they're not feeling included in the decision-making process, seniors are made more vulnerable and dependent. Seniors become more dependent and reliant on support systems. Seniors' quality of life decreases. There are less resources for programs with and for disadvantaged older adults. And so all of these things we want to try to avoid, particularly with self-advocacy. And when we are involved in self-advocacy, these are the things that we should be looking out for to make sure that our seniors are not feeling marginalized, that they are included. Seniors are not made to be more vulnerable and dependent. If we can maximize their independence as much as possible, seniors becoming more independent and less reliant on support systems. And I think sometimes when seniors have a particular health condition, say they have a fall and they hurt themselves pretty bad, that, sometimes people think, after that, they will need more support for the rest of their lives, but they can get rehabilitated. Some can, and then go on to live their life that they lived prior to that particular fall. And so it's just very important to be able to get in there as soon as possible to return someone back to the condition in which they were before. And I've seen so many examples of even physicians, particularly physicians who do not put in the effort to assist with seniors' healthcare because of their age, and kind of brushing off how they feel about a certain condition or whether or not they want an elective surgery, and encouraging them not to have it because of their age. And so all of this around self-advocacy is very, very important, because you still should have access to things no matter what age you are. So let's talk a little bit about self-advocacy skills. And some features of self-advocacy skills are to be assertive rather than aggressive. You've seen instances where people, are rough and angry on the telephone or in someone's face, instead of being firm and assertive without all of the anger and emotion behind it. People want to be able to listen and hear what someone has to say without the aggression behind it. And so we must also be direct and state clearly, firmly, and politely what your needs are. I've seen many people be able to master that very well. And if something is not clear to you, always ask questions. I think this even comes from when we are younger as children who may be uncomfortable with asking questions in a classroom setting because they're afraid of not being able to articulate the question correctly, someone not answering them appropriately or correctly, or even someone acknowledging them. And so even if all of that occurs, you still have to persist and continue to try to get your questions asked. You didn't answer, I didn't get the answer to my question. So if something is not clear, continue to ask questions. Also, listening is very important. Take time to listen to others and respect their points of view. Even though you might not necessarily agree with another person's point of view, remember they have a different thought pattern than you, a different paradigm than you. It's important to get your view across, but also respect the points of views of other persons. And when you need help, ask for help. A lot of times persons don't want to feel as though they are a burden. And I remember listening to someone and they said, that person calls me only when they need something. Well, yeah, we call people because we need things. And, we have to recognize that. And so when you need help, ask for it and exhaust your ask list as well. Acknowledge your own mistakes, particularly for self-advocacy. We won't get it right all the time. And if you realize that something that you may be speaking up for or something that you may have thought or made an assumption about. We have to be able to acknowledge our own mistakes, and that's a very key part of self-advocacy as well. And once you've mastered those features as far as self-advocacy skills, the benefits are you acquire essential information. And so the information that you're trying to seek, you acquire it. You're able to make informed choices. And so, you get the information and you think about whether A is better than B or B is better than A, and you can make an informed decision. You get your needs met. You ask for something and someone's out there who can help get an answer for you, or get something or a service that you may need. You get your needs met. And sometimes you may not be able to get your needs met from that particular person or that particular service, but you can seek other persons and other services as well. We say, because sometimes we believe when the door closes, then we should stop. But if it's something that's reasonable, that can actually happen, then you just seek the resources that you may know out there. And if you don't know about those resources, you ask around, and that's part of conversation building. Take charge of your situation. And that's very important in being able to acquire information as well. You experience genuine feelings of autonomy and self-reliance once you assert yourself with these self-advocacy skills. And it's all about empowering you as the individual, as a senior. Be very intentional. And so when you are out there self-advocating for yourself or for seniors, we must always be prepared. Make a list of your concerns, because sometimes if it's a very emotional topic, sometimes all those thoughts that you had in your head can be lost and can go out the door. And so it's important when your head is clear that you make a list of your concerns and you prioritize your list. That is also important, because you could have a long lines of concerns that you have, and you may be in a conversation with somebody and things can get sidetracked. And so you want to be able to prioritize your list so that you definitely get answers to the ones that mean the most to you. And then plan to give updates to those questions that you needed answers to, or maybe you need to demand updates from persons in which you had asked questions to. So that preparation piece is very important. Also, give accurate information and ask pointed questions. Very important. As a therapist, you have to be able to, I know for myself, and I don't know if there's any other therapists or even healthcare professionals in the room, being able to pull information out of people, because people don't always give you the accurate side. And so it's important that even in self-advocacy, that you are making sure that you're getting the accurate information, the information that you are seeking. And you can only do that by speaking up. Don't minimize how you feel. Speak up about how you feel, how something has made you feel. Again, ask questions, and again, listen, be prepared to listen. I'm sure we have all come into contact with persons who speak over individuals, and that person is not exercising good listening skills. So don't be that person. Wait and let someone complete their sentence, their thought, and that's what would be or contribute to being an active listener. Make decisions with others. learn about your options. And so when I spoke about earlier, you have some information. So that's your A information, and then you have some other information over here, and that's your B information. You can take both of those choices and speak about them with other people. And so other people can also give you another side and some more insight in regards to whether or not you should go with decision A or decision B, or there might be even a decision C. So take your time, because sometimes people feel as though they have to be very quick in making decisions, and sometimes you do have to be quick in making decisions. Be clear on what the service involves when you are engaged in self-advocacy. So if you're going to the doctor, even about, payment, the office tells you that it's going to be one price because you thought you were getting this service. You go to the office, another service is performed, and then it's another price. And so we have to be very upfront and understanding or being clear what that service involved. If that was not the service that you intended to get that day, you could say, no, that's not what I came here for today. And so I think we also have to recognize with self-advocacy that we can back out of things if it's not, part of the original agreement. Consider talking with other family, friends, or support organizations. This is, again, back to making decisions with others. There are some families who are very close, friends you may have whom are very close and you trust their guidance. Some support organizations who you can trust their thoughts and their guidance. And if you talk with them, then you can get an array of perspectives when it comes to making decisions about things that affect you. And share lingering concerns. If you're feeling uneasy about anything, speak up about that. That's the way that you get your answer as it relates to any concerns that you have. So be intentional and speak up, I think, are the most two important points, particularly for seniors in self-advocacy. And we probably have heard that theme throughout today as well. I want to speak a little bit about data collection because this is important for accurate information about any situation, need, and recommendations of seniors. These help to inform the development of appropriate and relevant policies and programs. And so data collection is very important even for yourself. Being able to collect data, and I'm just going to use the example again, visiting the doctor. Knowing what your record is, knowing when you've been to the doctor, recording what your ailment is, recording what the situation is, recording when you have to go back. All of this data is important information so that you can go back and check if there's anything that went particularly wrong and you have a concern about anything, and at least you have the data or the record to be able to cross-reference any new information in which you're getting. How to facilitate conversation. And this is an important piece when it comes to self-advocacy. I just talked about having notes and records as part of your data collection. The other important thing as a senior is sometimes when you're going into places which there's a service, if you're nervous or there's some sort of fear component, then you want to be able to have a second person in which you can relay information to. You don't have to, but it is an option. And so you want to come prepared with contact information that you can share with a service provider. Oh, I can't really remember, all of that right now. Here's my daughter's number. Can you call her and give her that information so that she can record it down for me? And also, as far as conversation is concerned, as far as self-advocacy is knowing what your time frame is. So you always want to ask the person who you are speaking to or wanting to get a question answered is to whether or not they have enough time to be able to address your question. And that can be by way of a telephone call or a one-to-one in-person meeting, because you want to make sure that you are front and center of that person's attention to make sure that you are able to get your questions or concerns met. And so if it isn't the right time, then you ask, can I make another time to come in and speak with you, or can I call you back at another time? What's also important as far as communication and facilitating conversation is asking what the preferred method of communication is. Don't be afraid to hold people accountable. So with those two pieces, there are so many methods of communication now. We have telephone, we have email, we have WhatsApp, there's Twitter, there's Messenger, there's text. There are many ways in which people now communicate. So as far as doing your communication electronically or in person, it's important to understand what your preferred method of communication is, as well as the person in which you're trying to reach out, so that you are creating a space or a comfortable space for a conversation to happen. As far as don't be afraid to hold people accountable. If someone says they're going to get back to you with something, make sure that you follow up, because sometimes people just get busy and can be difficult to get back to persons right away. But make sure you follow up and follow up so that you can get the issue or concern that you have addressed. Don't get mad if people don't call you back right away, but just follow up and say, hey, you were supposed to call me back, so that I can get that information. And that's how we hold people accountable for things in which they say that they're going to do or address. And also, it's important that it's a two-way street in praising and positively reinforcing a good outcome. A lot of times, particularly with self-advocacy, when we are facing a particular concern or challenge, that we highlight the negative part associated with that concern or challenge. But then when that concern or challenge is met with a good outcome, we should praise and positively reinforce that good outcome, because that helps with the relationship and conversations that could happen going forward. So some topics for advocacy as it relates to seniors. We spoke about healthcare. The healthcare space is constantly changing, and it will change. It will evolve as we get new updates with technology. The healthcare industry will evolve. And so every senior has a right to know what the evolution looks like. And so healthcare will be something that is constantly evolving and something that you will constantly have to advocate for, because things do change so rapidly within the healthcare field. Another big topic is caregiving. It's so many areas that we can go into as it relates to caregiving, types of caregivers, types of facilities that give caregiving within your family, within your homes, caregiving in a hospital setting, even the area around medications, advocacy, you can question the medication that is being prescribed for you. If you need to understand about the side effects, how much it costs, whether or not, what would happen if you didn't take it. We encourage you to take your medication if it's prescribed, but these are valid questions, and these are topics that come up as it relates to advocating for understanding your needs. Another very important topic is quality of life. If there is a quality of life that you are particularly used to as a senior, how do you maintain that quality of life? Which is a very interesting topic when it comes to self-advocacy. Outer abuse, a huge one as it relates to self-advocacy. I gave the example earlier of a caregiver who was allowing her client to talk and to speak up for the things that he or she needed. But I'm sure you could think of many situations where that is not the case, and someone speaking over a senior or speaking for a senior, or even in cases of financial abuse or physical abuse, seniors feeling intimidated or afraid of speaking up about something because they're afraid of the repercussions that a younger person or someone else would have on them. And so that's a huge area in regards to advocacy. Relocating. And when we speak of relocating, that can mean anything from what does it mean to leave your home and downsize to a smaller home, having to move out of your home into a nursing or residential facility, or having to leave your home and move into the home of your family, so that you are requiring, so that you can have more support if that's needed. And making sure that you have those options and you ask questions in regards to what that will look like for you as a senior. More topics that we can get into are intergenerational programs. If anyone does not know what that is, there are programs in other jurisdictions in which seniors rent their homes out to younger persons, so that there is an intergenerational collaboration, or there can be some sort of shared housing component. You have to make sure that it's somebody that you trust, of course. Or it's even programs, we see young children going into nursing homes or residential homes, interconnecting with seniors. It's very important in regards to how we can do that throughout our lifespan. Volunteering, making sure that there are opportunities out there for seniors for volunteering, as well as work opportunities and emotional needs of seniors. We hear often in regards to social isolation for some seniors, and what sorts of emotional needs seniors may have, and whether or not there are enough services out there to address the emotional needs of seniors, or even seniors who are taking care of seniors. We have a lot of occurrences of that in Bermuda, of seniors who are taking care of seniors. And thriving in a shared environment, recognizing that there are all ages within Bermuda in which we have to share our community. And so sometimes, if there is a community space, how do we make that inclusive so that it's not just for younger persons, that it is also a space for senior persons? And then an area of retirement, which is a huge area in which people will find themselves having to self-advocate a lot around. And, in regards to your pension, how do you want that distributed? Even You know, if a senior finds themselves being a widow, what sort of pension contribution, you know, is needed, and whether or not there are any kinks, or you find that there's red tape around in which a process can be made a lot more easier. So retirement is a huge area in which we find seniors will have to self-advocate around, even around the time period. You may not be ready to retire at the age of 65. You want to be able to work longer, and advocating for yourself for why you think you're still a good fit to be able to work longer, for organizations or companies who are saying, you know, no, you need to retire. And so that's a huge self-advocacy topic as well, especially if you're still able to do the job quite competently. Again, as far as self-advocacy is concerned, you must continue to be persistent. You don't get the answer from one person, you go to the next person to see if you can get the answer. You go to a family member or someone who may have gone through the same experience in which you have gone through. So you be persistent to see if you can get your concern addressed. And again, sometimes that concern may not be able to be addressed right at that moment. And so it may not take a day, it may take months, it may take years for that issue or concern to be addressed, but you still have to be persistent through the process. Also, get someone you trust to make decisions involved. Again, we spoke about earlier, family, friends, people that you trust to help you to make decisions. And also, when it comes to self-advocacy, if you don't want to self-advocate alone, you get your community involved. A lot of times we think that we are going through something alone, and we'll be surprised to know that there are many other people who are going through the exact same issue or concern. So start at the community level, recognize who your resources are in the community, develop strong relationships with persons in organizations or government. This is very important. In again, knowing who you can reach out to get answers that you're seeking. And then you want to go back and monitor and evaluate whether or not that decision that you made, that answer that you got, was helpful. And you go back and say, that was not helpful. I need something that's going to be helpful, because people have different interpretations of what helpful is. You know, sometimes passing it off to someone else, or keep passing something off to someone else, and you're still not getting the resolution or the answer which you're seeking. And so you have to take the time to monitor and evaluate whether or not, if something like this happened again, whether or not you would go the same route, or you would go a different route to be able to get the answers or concerns addressed that you had. Building effective coalitions. A very key one. Identify, in this, when I spoke about working at the community level, so identifying all potential concerned groups. There are many groups, there are groups out there that are working on the same concerns or causes that seniors may have. There's age concern, which is our biggest advocacy group out there for seniors. So I encourage anyone to definitely reach out to age concern and use them as a navigation tool and guide to be able to share your concerns with, because they deal with a large body of seniors who may be actually, or who have experienced the same issue or concern that you may have. And then also, yeah, so they have the same common interests. And so they're able to collect that information and that data to know what to advocate for seniors. Determine how groups can be brought together. So there may be another group out there that's also advocating for the same needs. And so recognizing that you don't have to advocate alone, that you can pull in other groups, other agencies who can be helpful to you getting information or services. Assure a key role for older persons in the process. A lot of times, I had mentioned earlier when we talked about different boards, committees, organizations where there are younger persons involved, making sure that things that are related to seniors have the input of seniors through different boards or committees or councils, or even just consulting publicly in general, getting a feel for making sure that we're including those persons who have the same common interests. We're including their input in the particular process for any outcome in which we are trying to achieve or get. I actually I feel like I've had a mouthful, so I can stop there if there are any questions. I can't see any questions popping up, so I don't know.
Hello again.
Hi, Alyssa.
All right, so I did see kind of a question / statement in the comments, so I'll just read it out. And it kind of came a little bit earlier in your presentation, but actually your last slide, you spoke to it a little bit.
Okay.
So interesting to see that it seems that both youth and seniors have common challenge of being marginalized without opportunity. Maybe rather than fixing one group at a time, find out how to pair generations to adamantly work together, one to teach, one to learn, and vice versa. Are there any initiatives such as this? So really combining the intergenerational process of individuals who are marginalized via, their age or the disability that they are experiencing.
Okay, here we go. So yeah, there are some great examples in other jurisdictions of how it's important to have shared communities. You'll see there are senior organizations or groups that get together, and it's important that those senior groups also include younger groups as well, and there were younger groups as well. And so when we talk about being intentional, there's younger groups who are also advocating for things that can affect seniors should also get together. I think we have to get out of the framework of a lot of times we do gather around persons who are similar in age and who have common interests and are similar, but to make sure that we're being very intentional about bringing an older generation and a younger generation together. And there are some things as well. I mean, we have lots of community clubs or community spots around Bermuda in which would be saturated with programs just for youth, and making sure that there is an inclusion of programs that occur there that also address programs for seniors. So yes, more collaboration as it relates to youth and seniors, that intergenerational piece.
I know from, oh, there you go. Question from Marissa Rogers. If you had to identify your priority for disabled advocacy in Bermuda, what would it be? So what would be the priority for just disabled advocacy in general?
I think hugely our population as it relates to disabled needs to come forward and be part of the conversation in things in which they would like to see. I think that is a huge piece. A lot of times we hear from persons who act on their behalf, And I think it's very important as far as self-advocacy that what we tend to do, particularly with self-advocacy, is just that part there, that self-advocacy part. And we don't operate to get advocacy as a whole. And so, again, there's common interests that we all may have, using it to a larger extent for advocacy to address common interests as a whole. So I would like to see more progression in that area. There's so many things. I mean, I could sit here and talk about that for a very long time. In regards, another big area is employment for persons with disabilities. It's a huge area. I know for years we've been working on this. You know, people going out trying to get jobs for persons with disabilities. So maybe we need to come together to strategize to see how we can improve upon this. And so again, less of the self-advocacy and more of the community advocacy and coming together. And the other thing with advocacy that I want to mention, because sometimes people come into advocacy with aggression and anger, and I don't believe that that's the way that we will get our needs met. We need to be able to come together and strategize to get our needs met. So, and also posting on Facebook and Instagram is also, I mean, it's a way to highlight something, but it's not an effective way to get something you want done that benefits a whole group of persons.
Going back to your presentation specifically, I found it interesting, and when I worked in hospital and with sort of senior population more intensely in the past, that a lot of times seniors, at least as seniors exist right now, obviously that changes as time goes on, really have this model of healthcare in that the healthcare professional is the authority, and we don't question, or you don't question that healthcare authority. I'm wondering if you see that shift at all as kind of, seniors change who they are and what demographic they are. And if that, that cultural perception or that age perception affects how well seniors might advocate for themselves in that context versus a younger person.
Yes, I do think that will thought will change, particularly as seniors are getting more savvy with electronics and information that is out there to their disposal, that they will start to question their healthcare involvement or their what's being proposed to them as a healthcare option. But I do agree that there are still many persons who will not, they will just take the healthcare outcome or the suggestion or the plan without asking questions about it to see if it actually works well for them. And then what we generally see when somebody doesn't work well for someone, then we see non-compliance. And so it is important. It's very important that seniors do stay on top of information and technology. I do see a shift in a older demographic, but not so much persons who are over the age of 80 or 90. And there may be some who are definitely on top of things and can definitely self-advocate for themselves. So
I think
we need to get that in our minds that, we need to be able to give seniors who are a bit timid, who may be a bit timid to speak up for things. But also, what's also important for seniors to do is to also recognize when they do need help. I was talking to a senior the other day, and, they still wanted to go ahead and go about their business and work and garden even though they were having health complications. And so there's the idea of, you know, wanting to continue as you once were, and not acknowledging how your health can affect your outcome, your function. And so even having conversations around that.
Mm-hmm. I think it's important. It's for those that are kind of in the healthcare field, or even someone who is supporting a senior that might be in that, you know, that 80 to 90 year age bracket, to recognize that how they might interpret the information given to them by, you know, a healthcare provider, et cetera, they might interpret that differently, and might interpret that directive as something that they must do, or something along those lines. And so they may interpret it differently than you see it as the suggestion or the service that's being provided.
Absolutely.
I really appreciate everything you've shown. And what I really liked and enjoyed is that all of the tips that were provided are important for everyone, whether you're a person who has a disability at any age, a person who's just trying to get, you know, the things their needs met. All of those skills that you mentioned and all of that advice that you mentioned is applicable to everyone. So I really do appreciate the comments and what you've put into this. I'm going to give us our code word for your session. So the code word for the session today is respect. So if you would like a continuing education credit for this presentation, you can send the word respect to Windreach at windreach.bm along with your profession to get that credential. We want to thank you so much for your presentation. If there's any questions or any statements for Ms. Tine Furbert, if anyone has anything in the chat, we'll let you get back to your very busy day.
I just wanted to say something that's very important with seniors, is that we always have to keep in mind, even as younger people, that we will experience things as we age, and that while we may not be an 80-year-old right now, or a 90-year-old, or a 70-year-old, or a 60-year-old person at this time, we will possibly be one day. And so an issue that is relevant to a senior today will also be relevant for us in the future. And I think, you know, when we talk about that shared community, shared interests, we will all age one day. And so that in itself is a shared interest, a shared community interest that we should all want for ourselves as well.
Agreed. As a newly arrived senior, I'm very thankful for your presentation. Someone has just written. All right, well, thank you, Tine. You're welcome to stop sharing your screen, and then hoping that Jessica and I can just have a few more kind of closing discussion about all of our sessions. They were fabulous all day today.